the fact that health, society, and the economy are inseparable. The pandemic has reminded us that health is the foundation of a functioning society, and that the value "no one is safe until everyone is safe" needs to be at the forefront. The second lesson calls to prioritize the preparedness capabilities, including the IHR capacity gaps within the all hazards framework. The third lesson indicates that response systems need to be functional long before the emergencies strike. The emergency response architecture, top-down, but we should not forget, bottom-up, needs to be ready for all hazards. Prepared health systems with breakthroughs in biotechnology, genetics, and epidemiology led to the isolation and sequencing of the SARS-CoV-2, thus delivering diagnostic tools and novel vaccines in no time. Lesson 4 is about the transformation of scientific discoveries into accessible and affordable public health goods. The fifth lesson is based on the fact that prepared health systems are those that use contemporary tools to access data and that use it for policy making. The true life-saving potential of data has yet to be uncovered, and a paradigm shift is required in how health data is sourced, governed, certified, protected, shared, and of course, digitalized. Lesson 6 is about recognizing the health systems and emergency preparedness, their connectedness, while lesson 7 is based on the fact that measures are only effective when they are scientifically sound, culturally acceptable, and are owned by the communities. The people need to be part of the solution. This requires new approaches of inclusive governance. Moreover, equity and solidarity must provide the compass for actions to improve health, social and educational services together with financial protection. National interests should be linked with international cooperation and global solidarity. Vaccine distribution teaches us that we are as strong as the weakest ones. The just published Euro Health edition, the new one, special issue in collaboration with the European Observatory on Health Systems, highlight these important issues that we just raised. Lesson 8 calls us to integrate emergency public health services and universal health coverage while investing in healthcare infrastructure and workforce is our lesson 9. Prepared health systems, requalified primary care, repurposed and redesigned hospitals, and optimized treatment of care of patients of COVID-19, alongside with the full continuum of health services from public health to primary care, hospital, rehabilitation, and palliative care are key. Such systems were able to train, deploy, protect, and support the health workforce. They are the hero of this pandemic, and we need to take proactive measures to support them all through the way and help them to communicate it with the rest. We need to train them and to have them all skilled at communicating risk and rapidly addressing rumors and misinformation. Our 10th lesson is prioritizing resilience. It sounds now really something that we all understand, but this requires a necessary leap to be taken by all of us so that we will prepare us and the next generations for the upcoming emergencies. The pandemic, if I may, also taught us humbleness, respect, and responsibility. We humans are, well, we all know it, we are part of a huge dynamic interaction between life and nature and among ourselves. We need to apply these lessons to the way we handle the environment, nature, animals, and everything else within the One Health web. And we need also to use it in the way we protect our health and the health of those around us. Next, please. We cannot stop as the pandemic journey continues. The regional director called for a high-level European expert group to take the step already. You mentioned it, regional director early on. It is chaired by Professor Flo. The expert handed a concise document with guidance on how to get out of the acute phase of the pandemic and move into stabilization phase. It is also on the web. They will continue adapting it as needed, and we are very grateful as they are leading us through the journey. Next. Being prepared for the next pandemic means ensuring that the current one is used to switch from coping to anticipating and transforming. The devastation of COVID-19 has brought us can only be worsened if we fail to learn. Today, we stand at a critical juncture when we are still crying over the loss of our dear ones, the sufferance that many of us are going through while experiencing the impacts and challenges of the pandemic. But we have the knowledge of nearly 2 years of fighting it. We now have an effective toolbox which we need to share with all. We have learned that no man and no woman is an island, and no country is a lonely planet. At the WHO Regional Office for Europe, under our regional director, under your leadership, we are committed to work with you to make sense of this wealth of lessons, to review the current action plan, and eventually develop a new one to reduce the human toll of future emergencies. Well, I want to thank you for listening to this, but we decided to also continue and interview some ministers and our partners, and to listen to them firsthand and to understand what they have gone through. The question we ask them is, what are the major lessons your country or your organization has learned in its response to COVID-19 that could be taken forward to the next emergency? Please note that in order to be on time, we really were forced to cut some of those messages, and we will try to accommodate all those later on. Thank you very much.
Thank you, Dr. Nitzan. And before I move to the pre-recorded ministerial panel, I'd like to say that it has been brought to my attention that the Russian Federation would like to exercise its right to reply under Rule 26 bis as per standard practice, based and in accordance with paragraph 10 of the special procedures. I will give the floor to the Russian delegation at the end of our meeting today. And now I'll move on to the pre-recorded ministerial panel. I understand that now we'll hear from a number of ministers who will share their personal experience and views through a series of short pre-recorded videos. We will start with Albania. I'm very glad to participate in this ministerial panel on COVID-19 lessons learned. We certainly welcome this initiative to take stock and to learn lessons and to look back collectively at the actions taken so we can analyze what worked well and where we need further improvements. Regarding our experience with quickly establishing an agile and flexible command control coordination structure in Albania, let me emphasize that preparedness and prior experience in managing crisis has helped. The immediate experience from the devastating earthquake that hit Albania in November 2019 and accumulated lessons from previous emergencies were critical to build our institutional readiness. The Command Control Coordination Platform allowed to engage all the stakeholders in the rollout of the COVID-19 vaccination campaign and to design and oversee respective public communication and community engagement. Through our collective efforts across sectors and partners, we were eventually able to achieve our vaccination coverage target so far, but we need to continue and further consolidate the rollout and increase the vaccination coverage. Through the Command's control and coordination structure, we also coordinate the necessary investments to strengthen public health, primary care and hospital services, and the repeatedly needed adjustments to service provision priorities with the perspective to sustain essential health services and to support the most vulnerable through targeted social protection measures. During this pandemic year, we have continuously reviewed our national guidelines arrangements to align public health safety measures to limit the spread of the virus with updated case management and investigation protocols. A newly established operational entity, the National Operator of Health Services, was crucial in following up the plans to scale up and adjust capacities as needed through the country. As an operational entity under the umbrella of the Ministry of Health and Social Protection, the National Operator of Health Services is overseeing the scale-up of testing, isolation, and contact tracing strategy, and also coordinating treatment capacities in the regional hospitals. This structure has contributed managing the health workforce expansion through mobilizing extra teams in different levels of care for testing, contact tracing, and strengthening medical teams in dedicated COVID-19 hospitals and in COVID-19 wards in regional hospitals. The strengthening of human resources for health was complemented by the government decision to substantially increase the salaries of the health workforce by 40% to value their continued commitment. And since the beginning of the pandemic, we incentivized them with an extra monthly financial bonus.
Well, now I'll give
Thank
the
you,
floor.
Chair, for the giving opportunity.
Okay. Now I'd like to introduce, I'll give the floor to Georgia, followed up by Moldova and Serbia.
Unfortunately, death toll is still high. Therefore, our primary goal is and should be strengthened preparedness at national and the global levels, strong intersectoral cooperation and sustainable strengthening of comprehensive mechanisms such as active biosurveillance and epidemiological control, as well as building capacities for diagnosis and treatment, enhancement of preventive measures are essential to efficiently overcome the pandemic challenges. Pandemic has also revealed necessity for strengthened additional mechanism of coordination between primary healthcare, hospital sector, and emergency medical care services. We can transform each new challenge into opportunity, and Georgia is a good example of this. Due to urgent needs in the pandemic management process, country has taken important measures to improve sustainability of healthcare system. The pandemic revealed necessity to speed up the process of strengthening state sector, which is ongoing with financial and technical support of the WHO, European Union, the World Bank, and other donor organizations. Besides, brand new and innovative approaches have been introduced, such as utilization of hotels for management of suspicious cases, as well as COVID-19 patients that have been uploaded by our international partners. The pandemic made more vivid the role of telemedicine and digital technologies in healthcare. Distance services significantly reduced mobility and risk of spread of infections in hospitals. At an early stage of the pandemic, Georgia introduced successful practice of electronic services such as online clinics, which represents an effective home-based management of COVID patients. Today we have vaccines, the main weapon to end the pandemic. Equitable access to COVID-19 vaccines has a significant importance for all the countries. COVAX, which represents an effective mechanism for fair distribution of vaccines, had a critical role in securing early doses of COVID vaccines in the country. However, it's essential to improve accessibility not only to vaccines, but to all public health benefits that are key tools in combating pandemics. The brief answer to questions what lessons are learned from the pandemic can be necessity to ensure pandemic preparedness, human resource strengthening for emergency response, introduction of additional mechanisms of coordination between primary healthcare, hospital sector and emergency medical care services, necessity to strengthen state sector, importance of digital health systems and intersectoral cooperation. I thank you for your attention.
When COVID-19 pandemic has started, the Republic of Moldova level of preparedness was insufficient in view of personal protective equipment and medicine stockpiles, as well as human and financial mechanisms to ensure that adequate response to the public health emergency. Epidemiological risks in the Republic of Moldova was exacerbated by severe political and economical crisis. Due to this fact, the response to the pandemic was late and highly politicized. Price paid by the health system was enormous. Moldova became a leader in the mortality rate among health workers, but in particular doctors. We lost more than 134 colleagues in the first year. In autumn 2020, the presidential election took place and pro-European candidate Maia Sandu was elected. This staggered the huge wave of support from the European Union, United States, and other development partners, in particular Romania. I would like to mention tremendous support of Moldovan diaspora, which gave us heartbreaking example of community engagement and supported country in the first weeks of pandemic, sending home oxygen concentrators and personal protective equipment. It is also important to acknowledge the role of the public health authorities and police, including border police, and entire support provided by all development partners, including WHO, UN agencies, EU, USAID, COVAX, governments of Switzerland, Germany, Norway, Austria. Joint effort and impressive stakeholders' engagement made possible that population of Moldova got access to the quality vaccines. Donation of vaccines from Romania and COVAX platform enable health authorities to start the vaccination of medical personnel immediately. We managed to reduce not only the mortality, but also the infection rate among doctors and nurses, and almost achieved herd immunity in this category of staff. Currently, about 95% of GPs, physicians and nurses, and 88% of medical workers from the Republic of Moldova are fully vaccinated. As of today, there is zero death in health workers and few cases of infection.
Najznačajnije mere i aktivnosti koje država Srbija sprovela tokom pandemije su da je Srbija izvršila efikasnu reorganizaciju i promenu načina funkcionisanja zdravstvenih ustanova, domova zdravlja i bolnica u cilju brže dijagnostike i adekvatnog lečenja pacijenata obolelih od COVID-19, ali i omogućavanje adekvatne zdravstvene usluge i lečenja pacijenata obolelim od drugih bolesti. Kapaciteti COVID bolnica su se povećavali u skladu sa intenzitetom transmisije virusa u zajednici i brojem inficiranih, u pogledu većeg broja bolničkih postelja za lečenje, kao i većeg broja raspoloživih respiratora za primjenu u intenzivnim negama bolnica i drugih medicinskih aparata i opreme. Izgrađene su 3 kompletne nove COVID bolnice, opremljene najsavremenijom opremom sa više od 2000 bolničkih kreveta. Značaj novoizgrađenih bolnica za lečenje obolelih od COVID-a ogleda se u činjenici da je pravovremena hospitalizacija obolelih ključna za uspešno lečenje. Unapredili smo laboratorijske kapacitete za dijagnostiku COVID-19 kroz povećanje broja laboratorija i obezbeđivanje dodatnog zdravstvenog kadra za rad u laboratorijama za PCR dijagnostiku. Pored navedenog, Srbija je uložila i velike napore u cilju nabavke opreme i distribucije iste zdravstvenim ustanovama, podrazumevajući respiratore, ultrazvučnu opremu, dopremanje kiseonika za terapiju obolelih, nabavke rentgen aparata. Na kraju, među najznačajnijim odlukama i merama moram istaći da je Srbija donela stratešku odluku da je nabavka bezbednih i efikasnih vakcina i masovna vakcinacija najviši prioritet za državu i u skladu sa tim preduzela korake. Tome smo naišli na podršku i razumevanje partnera u svetu koji su prepoznali našu jasnu viziju. Rezultat toga je činjenica da je Srbija među prvima u svetu svojim građanima obezbedila vakcine različitih proizvođača i omogućila im izbor koju će vakcinu da prime. Srbija je, kao što znate, među prvim zemljama u svetu već 24. decembra 2020. godine započela vakcinaciju stanovništva počev od prioritetnih kategorija. Do 3.9.2021. godine u Srbiji je ukupno vakcinisano 3. dozom preko 208.000 lica.
Dear colleagues, there are many lessons learned from pandemic. One of them, and maybe the most important one, is that we need to increase our capacities. Capacity of response and resilience, capacity of multilateral coordination, and capacity of leaving no one behind. This pandemic has tested these capacities and has shown some structural weaknesses in fields like epidemiological surveillance or on the amount of resources for primary attention and research. It has also revealed the risk for global health, behaviors like vaccine, nationalism or fake news. But there are also positive conclusions. We are now better prepared for upcoming challenges. Spain has a public health system that is strong and universal because of the improvements that we have been implementing. We have already reached the goal of immunizing over 70% of our population in 8 months. We have proved our strength by reaching national goals while contributing globally with our vaccine sharing. I can proudly say that my country has learned great lessons during these last 20 months. We have confirmed that we have a great national health system and committed health workers that have made it through the pandemic. In addition, we realize that comprehensive health surveillance must come first in all our health policies. I can say something similar regarding primary attention, the milestone of our national health system, the closest to our families and our community. Thanks to primary attention's doctors and nurses, the Spanish vaccination culture has defeated an anti-vax movement and social rejection. Moreover, we learn how crucial co-governance is. In Spain, our national health system has facilitated a proactive dialogue with our region even in the hardest times. That improves tailor-made measures for the different regions of Spain, but always thinking of the greater good. That's unity of action. Governance works and its mechanisms must be powerful and have enough human and financial resources. Dear colleagues, I want to send you a clear message. We need a strong global health today to protect our citizens from tomorrow, the threats. Thank you very much.
Sayın Başkan, saygıdeğer bölge direktörü, kıymetli katılımcılar. Öncelikle ülkemin ve şahsımın COVID-19 ile mücadele sırasında edindiği tecrübeleri paylaşma fırsatı sunan böyle önemli bir oturuma konuşmacı olarak davet edilmem nedeniyle sevgili dostum Hans'a ve emeği geçen herkese teşekkür ediyorum. Hepimizin bildiği gibi iyi bir pandemi yönetimi, vakitlice yapılmış hazırlıklılık planları, iyi inşa edilmiş sürveyans sistemleri, teknoloji ve kaliteli insan gücüyle desteklenmiş yaygın, güçlü sağlık altyapısı ve iyi organize olmuş sağlık sisteminin sunduğu yanıt kapasitesiyle başarılı bir şekilde yürütülebilir. Kapsayıcı sağlık güvencesinin sunduğu tedavi hizmetleri ve iyi planlanmış ve önceliklendirilmiş zamanlı aşı tedariği de pandemiyle mücadelenin başarısını derinden etkileyen unsurlar olarak ön plana çıkmıştır. Sağlık çalışanlarının fedakar ve özverili çalışmaları ise tüm bu başarı unsurları arasında beşeri sermayenin de önemini teyit etmektedir. Kıymetli katılımcılar, bu toplantı vesilesiyle pandemi yönetiminde çok önemli bir olgu olduğuna inandığım toplumu mobilize etmenin ne kadar önemli olduğunu öğrenilmiş dersler ışığında sizinle paylaşmak isterim. Pandemi süresince hükümet politikalarını ve halkımızın günlük yaşantılarını derinden etkileyen, tasavvur edebileceğimizin bile ötesinde çok radikal kararlar almak zorunda kaldık. Bu süreç içerisinde karar mekanizmalarında bütüncül bir hükümet yaklaşımının parçası olarak paydaşlarımızın katılımını sağlamak da çok önemli bir vazifemizdi. Diğer yandan belki de en zor olanı kapatmalara, halk sağlığı tedbirlerine, tedavi metotlarına, özveri ve fedakarlığın gerekliliğine, yani toplum mobilizasyonu konusunda başarılı olabilenler pandemi yönetiminde bir adım öne çıkabilmişlerdir. Şöyle belirteyim, pandeminin ilk başladığı günlerde toplumumuzu maske kullanmaya teşvik etmek için mücadele ederken, geldiğimiz noktada aşı olmaya teşvik etme süreçlerini yaşamaktayız. Bilim ve kanıta dayalı güçlü, sürekli ve samimi bir iletişim metodu oluşturulması, toplum mobilizasyonunda başarıyı getiren temel kriterdir. Türkiye'de de pandeminin ilk gününden itibaren bu anlayışla hareket etme gayreti içerisinde bulunduk. Hem bilime hem de kanıta dayalı bu enformasyonu doğrudan en üst politik seviyede tüm ilgili paydaşlarla ve halkımızla paylaşma metodunu benimsedik. Bu yöntem pandemiyle mücadeledeki en zararlı unsurlardan olduğunu düşündüğüm infodeminin etkisini minimuma indirmiş, toplumsal katılıma ve bütüncül uygulamalara maksimum katkı sağlamıştır.
The strength that we've all learned is the human factor and the healthcare workers. And because we know how important they are, I think the first lesson that we should all learn from it is that we need to invest a lot in our healthcare workers, in the professionals. We need them because without them, we won't be able to combat anything in the future. That is the first thing. At the beginning, I think that they were a little bit sidelined. And they didn't take enough part, not as an organization and not as individual, with the decisions, or at least that wasn't the feeling. They didn't feel that they got enough information. They didn't feel that they knew exactly what was happening. And even when we're talking, for instance, about personal protective equipment, it wasn't at the beginning completely, didn't make people feel safe enough. So I think that the most important lesson that I would like to say at the beginning is that we need to invest in the healthcare workforce. We need to make the physicians feel safe. We need to give them information, and we need to encourage them to take a role that they did take as bringing forth messages to the public. One more thing that I want to say is we also have to invest into the healthcare systems. We cannot wait for a pandemic and then just decide that we are investing. And we know that many countries around Europe and possibly around the world at that point actually put in a lot of money into the healthcare system. But we need to be prepared before. We need to be in a situation where we will have enough hospital beds, where we will have enough physicians in the ambulatory setting, where we will have enough facilities to answer for the geriatrics needs and so on. And if we do that on an ongoing basis, then hopefully when the next crisis, I don't know if it will be a pandemic or anything else, we will be better equipped for it. So I think that there is work to be done. I would like to just point out one positive lesson, and that is the collaboration. I think we would have never been able to overcome it without collaboration between all the stakeholders and all the players within the regional and within the international setting. We would never be able to get a vaccine or several vaccines within a year if it wouldn't have been a multi-central collaboration. We would never know how to treat our patients if we wouldn't be able to call our colleagues in other countries and learn from them what to do and what not to do. And if we are at the race for maybe finding medication, again, we need collaboration. So I think a collaboration between governments, between NGOs, between physicians and other healthcare workers, and between the public, I think that could be the best solution we could have.
Well, thank you very much, ministers. Dr. Webner from European Forum of Medical Associations. Let me now pass on the floor now to Executive President Dr. Sidanauki for managing the discussion. Thank you.
Thank you, President Manastirli. Happy to assist you leading the RC71 discussions in the middle of these extraordinary times when the solidarity and joint actions are needed, perhaps more than ever. I now open the floor for any possible remarks, and we have here the list and order of speakers, and the floor goes first to Slovenia on behalf of the EU and its member states, followed by Denmark and Netherlands. Slovenia, the floor is yours.
Thank you very much. Chair, Director General, Regional Director, Excellencies, ladies and gentlemen. I have the honor to speak on behalf of the European Union and its member states. The candidate countries Montenegro and Albania, as well as the Republic of Moldova, align themselves with this statement. The European Union thanks the Secretariat for the reports. Learning the lessons from COVID-19 is critical in order to better address new and emerging threats and to address the severe damage caused by the current crisis. At the same time, we must prepare for different types of future health emergencies, such as the silent pandemic of antimicrobial resistance. In many ways, no region or country across the world, including the European Union member states, were ready for a pandemic of this scale. Preparedness and planning had been underfunded and underdeveloped. Much of the response has had to be designed as we went along. Coordination and cooperation between member states was insufficient and challenging, and took time to be developed and start functioning. Valuable time was lost in the early stages of the pandemic as the right structures were not in place. Speed, scope, ambition, and solidarity have proven to be essential and best achieved through strong multilateral cooperation. The lessons learned from this pandemic will be crucial in preventing the next one. The European Union is committed to an active and constructive role in the discussions at global level on strengthening WHO and health emergency preparedness, as well as on sustainable financing. The ongoing assessment of the different recommendations by the Working Group on Preparedness and Response is critical. The implementation of the international health regulations is the responsibility of all member states. It is clear we must do better. Beyond core IHR capacities, leadership and governance, strong and resilient health systems, accountability mechanisms, and sustainable domestic financing of preparedness have proven to be essential. Monitoring and evaluation of country capacities has been an important development that has not sufficiently captured the variety of preparedness and response needs across sectors. Furthermore, longer-term and sustainable resourcing of actions remains a challenge that needs to be addressed. This pandemic has shown there are areas that are not covered by the IHR or other existing mechanisms. The European Union believes that a new international legal instrument on pandemic preparedness and response would complement the global health emergency preparedness architecture while being mindful to avoid possible overlaps with existing structures. We need also to build on the experiences of effective ways of cooperation developed during the response. The ACT Accelerator and its COVAX mechanism for equitable access to COVID-19 vaccines point to the value of having an end-to-end solution for medical countermeasures in place during normal times. The ACTA strategic review will give us useful insight. Sufficient global manufacturing capacity alongside mechanisms for fair pricing, transparency, and accessibility, as well as increased voluntary sharing of know-how and technology is essential. We need to further strengthen cooperation in the human-animal environment interface through a One Health approach, including between WHO and FAO, OEE, and UNEP. This will help us prepare not only for zoonotic risks, but also for AMR and climate crisis, among others. The risk of increasing health inequities, burden of non-communicable diseases, and toll on mental health are significant. Understanding is critical for future preparedness and resilience. Timely sharing of data and digital tools are essential for modern public health management and preparedness. The European Union supports the strategic directions proposed on leveraging the impact of digital technologies in the context of pandemic preparedness and beyond. We encourage all member states to take steps towards making this the last pandemic by critically evaluating and building on the lessons learned. Political leadership and multi-sectoral commitment are required in every member state when implementing the necessary changes. Thank you very much, Madam Chair.
Thank you, Slovenia. Next, Denmark, followed by Netherlands and UK. Denmark, the floor is yours. It seems that we have some technical problems to connect to Denmark, even we are here in Copenhagen. I would now call Netherlands, and let's see then if we can contact Denmark. Netherlands, please.
Good afternoon, Madam Chair, distinguished colleagues, and dear Hans. The Netherlands aligns itself, of course, with the statements made by Slovenia on behalf of the EU. Let me start by expressing my appreciation for the tireless work of the World Health Organization and of all health workers worldwide. But also of you, Hans, and your team. Your inspiring enthusiasm and the work of your team are very important for the region, especially in the months we have behind us and the months to come, I would say. And this COVID pandemic has taught us a lot about the strengths and the weaknesses of our respective healthcare systems, the global health architecture, and the essential role of the WHO. Therefore, we believe that our energy should be aimed at concrete actions in at least the following areas. Firstly, we need to reevaluate and strengthen our local and national public health services and give priority to full IHR implementation and to the prevention of non-communicable diseases, so we make sure that our populations are as healthy as possible. Secondly, we need to secure the availability of essential medical products and enlarge the worldwide capacity of sustainable products and production. The Netherlands will, therefore, we have committed ourselves to donating all our surplus vaccines to lower and middle income countries, especially through COVAX. And we call on all other countries to do as much as they can when it comes to donating of vaccines. Furthermore, the Netherlands will, in collaboration with the World Health Organization, organize the next World Local Production Forum. And this forum will be aimed at increasing access through public-private partnerships and sharing of knowledge and technology. Thirdly, we need to improve collaboration on health security and pandemic preparedness on the basis of a One Health approach. The interaction between animal health, human health, and the environment, and the challenges of climate change for the health agenda requires common action, including prevention of antimicrobial resistance. We can only overcome these challenges if we are transparent about what is going on in our countries and improve data sharing and collaboration. We have to work on increasing trust and international solidarity, and we should be supportive of a pandemic treaty that represents a generational agreement. A strong WHO at the heart of the global health coordination can help us facilitate our dialogues and provide the necessary guidance for our governments. For this, we urge all member states to strengthen existing structures of the organization, including the regional offices, and provide predictable and sustainable financing. Let us learn from this pandemic and protect the health of all our people. Thank you very much.
Thank you. And now, do we have a connection to Denmark? If not yet, then I would like to ask UK to take the floor, followed by Israel and Monaco. UK, the floor is yours.
Last week at the G20 in Rome, we saw how we're all in the same boat, dealing with the consequences of a devastating global pandemic. Even while we do that, we must also learn lessons for the future. First, we saw how clinical trials turned the tide of the pandemic. We must keep going. Whether it was the WHO's Solidarity Trial or the UK effort that found the benefits of dexamethasone, we all benefit from this life-saving work. But making trials work must be a collective endeavour. The Clinical Trials Charter, agreed this summer in Oxford with the G7, will help end unnecessary duplication of trials, ensure greater collaboration across borders, and faster access to approved treatments and vaccines. Working with industry, we have also set a shared goal to cut the time that it takes to develop and deploy new diagnostics, therapeutics, and vaccines to just 100 days. Because in a pandemic, it's not just about progress, it's about the pace of that progress. I must also urge everyone to do their utmost to resolve the issue of vaccine certification for people who took part in clinical trials. They stepped up for science, and we must step up for them. Second, genomics has been indispensable in this pandemic. It'll also be crucial to preventing the next one. We will offer UK expertise via our new variant assessment platform and global pathogen analysis system as part of the global pandemic radar. Next, we must have a shared understanding of the origins of the COVID-19 virus. The phase 2 study must be prioritised. It must be transparent, evidence-based, and expert-led. Because when diseases can cross that divide between animals and humans, it matters to us all, and it matters to our future. And finally, we must protect the miracle of modern medicine and tackle the silent pandemic of antimicrobial resistance, which could have consequences far deadlier than COVID-19. We must also get better at using existing antibiotics, whether for humans or animals. We must share and develop new ones and ensure safe global supply chains. In the early stages of this pandemic, we faced the disease without any proven treatments. We can't allow the world to be put in that position again. But I believe, through the sum of all these actions, we can avoid that fate and herald a healthier, safer, and more sustainable world.
Thank you, UK. And next, Israel, followed by Monaco and Russian Federation.
Honorable Chair, Director General, Regional Director, Ministers, Ambassadors, and colleagues, good afternoon from Japan. We've all faced a terrible pandemic for 8 months now, but we have faced it together. Countless lives have been saved through international cooperation and the efforts of the WHO to collaborate in combating this pandemic. Still, we have a way to go, and it is too early to predict the end of this pandemic. But I believe some lessons can already be learned and applied to both this pandemic and future outbreaks. First of all, cooperation. COVID-19 has taught us of the need to adapt the way we work together cross-government and internationally. Information sharing and coordination have been a key factor in effective policy and implementation. With a joint emergency management center created in Israel to coordinate interministerial efforts to combat the pandemic and daily calls between expert international gathering, best practices, and critical information to inform the decision makers. Second, home care. Flexible approaches to future health systems has been critical to maintaining operational continuity of the health system throughout the crisis. In Israel, we expanded our healthcare options to include home care options. This system was critical to freeing up our hospitals and resources. Third, digital tools. It is absolutely critical to integrate digital tools to ensure remote access and enable better service while maximizing efficiency of healthcare workforces. Digital tools can also stretch scarce resources not only during emergencies, but even in routine times. 4, travel. Safe travel systems must be put in place in order to diminish the risk of variant spread. We need a comprehensive system of testing, secure and verifiable vaccination, certification and risk assessment of new variants paired with early detection of high infection areas. Green Pass. In Israel, we are reopening our economy on the basis of a Green Pass system available to all on the basis of vaccination, recovery, or testing. Blunt tools such as lockdowns are not sustainable. This is our conclusion. Blunt tools such as lockdowns are not sustainable as we rebuild our economies and learn to live alongside with this terrible pandemic. We are using this Green Pass system to enable businesses to safely reopen and expand capacity, to enable people to be together after far too much time apart, and to begin to heal the psychological wounds of the past year and a half. Another important issue, fake news. Information knows no borders, and I call for a regional approach to combating anti-vax sentiments and tackling misinformation. Often data or experts from one country are misrepresented in another in order to undermine vaccine confidence. Only through international partnerships we can address this misinformation before it has succeeded in undermining national vaccination efforts. A regional task force would enable collaboration and data sharing to combat misinformation, fake news, and maintain vaccine confidence. Another important point, vaccine production. We need to expand capacity for vaccine production and distribution. This pandemic has shown that vaccine production facilities are no simple good to be traded across borders, but that access to safe and timely vaccines is a critical factor of national resilience. Nations should cooperate between themselves and with industry in order to expand that capacity and maintain surge capacity for times of need, just as we may for other emergency supplies. Lastly, regional cooperation. It is essential to expand our cooperation so that we can learn from each other. This is why I met with my Palestinian colleague from Ramallah. This gathering is so important, this one. And so I hope we can all meet face to face and continue this important work together. Thank you very much.
Thank you, Israel. I would like to kindly remind you about what we have agreed of the length of the comments from you. There is a lot, I understand that there's a lot you would like to include into your comments, but we have very, very challenging timetable here. So please, I ask your understanding, and if you try to keep in 3 minutes time, in your national comments. Now I would like to ask and give the floor to Monaco, and after that Russian Federation, and then we have Denmark's comments through video. So Monaco, the floor is yours.
Je vous remercie, Madame la Présidente
Thank you, Madam Chair.
pour votre élection.
Congratulations on your elections, indeed. The Principality of Monaco is a staunch defender of multilateralism, and we support solidarity and cooperation. Thus, my intervention will be that of the perspective of a microstate. There are 3 important conclusions. 1, we need to strengthen Monaco's autonomy.
À titre d'exemple,
This allowed us, for example, to implement screening centers and to locally produce masks and hydraulic gel.
Pour mieux gérer cette crise sanitaire,
we've also taken measures to better manage this crisis.
De masques,
for example, by distributing free masks.
De larges tests afin.
And we've also run a large testing program to see the level of protection among our population. Finally, we've also shown great innovation in our crisis management.
Transformation des systèmes de santé.
We've transformed our healthcare systems. This project was planned but was speeded up. Thus, we've created a digital database with all the test and vaccination results. We also have patients' medical file.
Pass sanitaire européen.
And we've created a pass which can be adapted to the European pass.
Mais aussi le développement de campagnes.
Moreover, we've developed digital awareness-raising campaigns online on social networks to inform about COVID-19 and in particular about vaccination. We hope that this information will help provide you with information on how we've tried to support our population, and we should like to thank the Secretariat for all the documents supplied. Thank you very much.
Thank you, Monaco. Next, the floor is for Russian Federation, followed by Denmark and Germany. Russian Federation, the floor is yours.
Спасибо, уважаемая госпожа председатель.
Thank you, Madam President.
Разрешите поблагодарить
Allow me to thank the Regional Director Hans Kluge and the entire team of the Regional Office for Europe, including the country representations, for their commitment and the selfless attitude and professionalism in these difficult times. The dedication with which you fulfill your duty merits every admiration. Thank you. What are the main lessons to be drawn at this stage of the pandemic, which is not yet over? Firstly, at the basis of efficient reaction is the management, the ability of the country, the government to ensure coordination at all levels, the national, regional, and also to develop correct communication with the population. Moreover, it's very important how quickly decisions are taken. Secondly, strong systems of health monitoring with a good laboratory network and scientific support are the basis to protect from epidemiological threats. The pandemic highlighted important shortcomings in the system of reaction in many countries, but most of the countries where there's a lack of decentralized health monitoring suffered the most. The pediatric monitoring needs to be strengthened at national, regional, and global levels. Specific attention must be given to the preparation of medical staff on issues of infectious safety. Thirdly, the pandemic catalyzed the implementation of advanced technology, including digital technology. Must study the experience of the use of technology in combating the pandemic. We should assess not only benefits but also the risks. It is very important to ensure the role of the sub-regional and regional coordination. The timely measures taken by Russia together with the CIS and the ECE have made it possible to take efficient measures against the pandemic. In all these areas, my country is ready to share its experience. Dear colleagues, the pandemic has shown that a lot is still unknown, and we were wrong in a lot of areas. For example, the assessments of the readiness of countries were wrong. The ones that were given at the beginning of the pandemic, among those who suffered the most were states who are the leaders in the rating of the Global Index of Health, which was published in 2019 by the Johns Hopkins University. Russia supports a strong, independent WHO, which does not double the work of other organizations. Timely responses cannot be implemented, and we cannot create new systems. So we did not understand why the old one didn't work. We must not falsify the readiness of countries. We see risks in political, financial, and technical areas in this initiative. We have not yet understood the role of other agreements, but we're talking about the creation of a new agreement. The pandemic must not become the reason for an approach which is not supported by all states, such as an outside estimation or assessment. We stand ready for further joint work with WHO, Europe, and other countries in order to protect our citizens from epidemiological threats. Thank you.
Thank you, Russell. Oh, we have technical problems with the statement from Denmark here. So I would now like to ask Germany to take the floor, and after that, Azerbaijan and Austria. Germany, the floor is yours.
Vielen Dank, Frau Vorsitzende. Lieber Hans, Deutschland schließt sich dem Statement von Slowenien im Namen der EU und der Mitgliedstaaten an.
Germany associates itself with the statement made by Slovenia on behalf of the EU. We are pleased that in the Euro region, these important lessons have been learned. The COVID-19 pandemic is not yet over, so we need to look at a long-term perspective.
In the report.
There is a great deal of truth in the report. It's quite clear what can be improved.
Plan to improve public health preparedness,
and it's good that there's the plan for better public health preparedness. It is necessary to take into account the analysis made by experts, particularly in terms of the One Health agenda, so that we won't be surprised when the next pandemic comes around and we will be prepared. We need to do this in order to protect both ourselves and following declarations. The same holds true for climate change. This is a crisis that the entire humanity is facing. So we must reverse it. There can also be health effects of this, which we must predict. We believe that the new action plan mustn't disappear. We need stronger support from all in order to ensure that with the WHO we can truly make this actionable. Thanks to sustainable financing, we must also allow the WHO to take on its true, fully fledged role. So, the regional organizations must work closer with Stockholm and other international authorities. Digital technology can notably play a great role, not only in overcoming and managing the crisis, but also in providing care for patients during the pandemic. Making sure our health systems are more resilient requires a paradigm shift. As such, we must improve our data, make sure our data is certified, and use it together. That's why protection and data security is particularly important. In the European region, we can play a decisive role in this. And thus, we need to be decisive when it comes to the special sitting at the end of November, and we must ask for greater preparedness and response from the WHO. Thank you very much for your attention.
Thank you, Germany. Now I would like to ask Azerbaijan to deliver its statement, followed by Austria, and then Finland. So, Azerbaijan, floor is yours.
Dear Chair, dear Director General, dear colleagues, ladies and gentlemen. Over the past 2 years, the COVID-19 pandemic continues to put much pressure on healthcare systems worldwide. This is an unprecedented crisis the world has been facing, with an emergency centered at the global public health. The pandemic has exposed weaknesses across the world's health systems, including the most economically developed countries. It has led to serious disruptions in the delivery of essential health services, including primary health care. To mitigate far-reaching implications on our economic, social, and political life, it requires an urgent joint response. In this regard, the transformation and enhancement of innovative digital healthcare platforms will make a positive impact on deployment of effective and proportionate public health, the scientific capacity of human capital, sharing international best practices, case management and contact tracing, telemedicine use in primary health care, providing electronic vaccination certificates, population awareness on anti-COVID measures, and psychosocial support for patients and frontline medical workers. We now have the opportunity to take advantage of these innovations for their successful implementation and effective solutions in the post-pandemic period. To tackle critical public health challenges in the long term, we need to go beyond health and address the socio-economic determinants of health. The time has come to embrace a new approach when investing in health, and health systems should not be considered as expenditure, but as investment in the foundation of resilient and sustainable economy. With public health foremost in our minds, we need to set the status of health as a prior goal for social and economic policy. Azerbaijan forged ahead with the World Health Organization global vaccination targets. Within the framework of the strategy for vaccination of the population against COVID-19, adopted by the government in January of this year, about 40% of the population's target group is currently covered by the full course of vaccination. In addition, we also share vaccine reserves with other countries in the region. While remaining committed to the principles of global solidarity, I am convinced that our joint efforts to deepen integration processes in all areas will contribute to ensuring sustainable preparedness for future health emergencies and reach a new level of access to health services. Thank you for your attention.
Thank you, Azerbaijan. Now I would like to give the floor to Austria, and then after that we try to play the video from Denmark, their statement, and then I would like to ask Finland to be prepared. So, Austria, please.
Thank you, Madam Chair. Dear colleagues, Austria fully aligns itself with the statement delivered by Slovenia on behalf of the European Union and its member states. And the COVID pandemic has shown how much we can achieve when we really combine our strengths in research and development, in innovation, in the work of civil society and global solidarity. And for the sake of time, I don't want to repeat all the valuable statements already made, and therefore Austria supports all initiatives which foster collaborations and cooperation with existing networks, repositories, and scientific groups to strengthen knowledge and to contribute to the advancements of effective, efficient, fair, and equitable response to epidemic public health events. But may I draw your attention, because nobody has mentioned that, and one of the lessons we also learned, that we have to improve our governance structures on the global level within WHO itself. And I think we all probably can agree very quickly that, for example, the executive board of the WHO on the global level has not played a proper function and had not had the proper possibility to consult on many matters, like how to set up COVAX, how we set up new pandemic preparedness hubs, or many, many other issues when it comes to trade or traffic. So having said this and we have to look forward, allow me to draw your attention that as a member of the executive board for the European region, I will put forward a small, but I think also an important proposal to strengthen the governance capacity of the executive board in the case of a pandemic crisis. And in line with the recommendations you find in several of the reports how to strengthen governance within WHO, and with the support of the Director General and many other members of the executive board of the member states, I will propose the creation of a standing committee of the executive board on pandemic preparedness and response, which, and this is the most important message, has to be convened within 24 hours after a global health emergency has been declared or announced. And this is to strengthen the role of the member states in guiding the Director General in a situation like this. And it is also to narrow the gap between WHO scientific advice in the many bodies we have, and they are all working fine, and the actual policy level in the member states, and also to overcoming the structural shortcomings that have been manifested themselves during the current pandemic. So this is to safeguard that we, the member states, can start substantial policy consideration after such a pandemic health emergency situation has been declared. And this is maybe the very first lessons learned to improve our own governance structure within WHO, and it is also a low-hanging fruit. So may I ask all of you to support this initiative, which will be put forward at the next regular meeting of the Executive Board in January 2022. On the national level, if I may also echo what some of the other delegates already have mentioned, on the national level, I think one of the most important lessons that we have learned in Austria is how important it is to strengthen primary health care. You know, as a high-income country, we didn't have the big issues when it comes to ICUs, emergency capacity units, et cetera, ventilators or whatever. But, you know, it manifested that we do have a problem at the level of primary health care. And this is not only a structural problem, it is, as it already was mentioned too, that we do need a suited workforce in such a kind of situation, in a pandemic situation. Otherwise, and if we don't invest in this suited workforce, we cannot succeed in a better pandemic preparedness and response. Austria, therefore, will invest in this sector quite a bit of money, and we will use a substantial part of the EU recovery and resilience funding for these purposes, which we can spend on the national level, because this is probably on the national level the most important lessons we have learned, at least here in Austria. Thank you very much, and I yield back to you, Madam Chair.
Thank you, Austria. And now we are going to have the comment from Denmark, and after that Finland, and then we will have a break because we have to then start at 16 o'clock the report from the Pan-European Commission. But now Denmark.
Dear ministers, dear colleagues, thank you for sharing your experiences on best practice. To become resilient against future health emergencies, it is essential that we learn from each other. Unfortunately, the challenges are far from over as new variants of COVID-19 keep emerging. At the same time, access to vaccines remains a challenge in many parts of the world. Throughout the pandemic, communication has been the center of our effort to manage COVID-19 here in Denmark. It has been a priority to maintain trust in health authorities. Continuous updates and transparency in the decision-making have been key elements in tackling disinformation, especially regarding the vaccines. In areas with high incidence rates, we have engaged with local communities in order to break through potential cultural or social barriers and encourage social distancing, persistent testing, and vaccination. Two measures in particular have been valuable weapons in the battle against COVID-19: easy access to testing and the systematic rollout of vaccines. Testing facilities located in all areas of the country where citizens could drop in without appointment and free of charge have led to an increased number of tests, and this have enabled comprehensive contact tracing. And up until September, the digital Corona passport has been required to enter most public places, which has played a vital role in the gradual reopening of the Danish society. In the Danish vaccination rollout, frontline health workers and vulnerable groups have been first priority. During the last stages of our rollout, the oldest and the youngest in a target group have been vaccinated simultaneously. And by sandwiching those most at risk with those more likely to be barriers of the virus, we reduced the risk of spreading of the virus. Continuous sharing of experience is vital in order to bounce back from the challenges we face both at a national, regional and global level. Thank you.
Thank you, Denmark. It seems impossible to close the agenda item in time, and I propose to suspend the session after Finland's statement and reopen then again perhaps early in the morning tomorrow, but we'll come back to that then later. But now I will give the floor to Finland and then some household information. Finland, the floor is yours.
Thank you. Honorable Executive President, Regional Director, Excellencies, delegates. Finland aligns herself with the statement of the European Union and its member states and the statement of the Nordic and Baltic countries. The results of Finland's response to the pandemic have been relatively good, with the lowest attack rate and population mortality of the region and the third lowest case fatality rate. Our society has resisted the economic shock relatively well. Our health system has also demonstrated resilience despite the substantial strain on health services provision at all levels during the pandemic. The comprehensive government security strategy for society, effective governance, and a tradition of collaboration across sectors, coupled with trust in public health institutions and their messaging, material stockpiles, and very importantly, the universal social protection net, have all contributed to these results. The normative guidance of WHO and the EU cooperation have very significantly supported our response. We took rapid action, even without full certainty of the effectiveness and consequences of those actions. Legislation triggers were adjusted to justify the necessary public health actions, always acting strictly in accordance with principle of rule of law. The trust of the population in health experts and government decision-making has to a large extent remained high. Nevertheless, none of the plans and preconceptions were comprehensive enough and did not contain truly realistic scenarios for a pandemic of this scale and magnitude. We were truly shocked how during the first weeks of the pandemic, international cooperation according to the IHR was set apart, and how country after country turned inwards and started to look for commodities. To avoid a similar catastrophic situation in the future, we need a revision of the international preparedness regime to increase country-level preparedness, including through the full implementation of the IHR, and to invest in primary and public health capacity, workforce, and digital solutions. We also really need novel ideas of how to ensure a sufficient surge capacity in our health system, not to speak about fast development of and equitable access to various countermeasures. Finland will participate constructively in our common projects to make the world a safer place from health emergencies. Thank you very much, Madam Chair.
Thank you, Finland. We have had very intensive day today, and it's time for a pause. I now hand the floor to Executive Director Mr. Butler for some housekeeping message. Please.
Thank you very much, Madam Chair. So we're going to carry on with item number 3 tomorrow morning at 8 a.m. CET. We are going to open proceedings at 8 a.m. CET because we simply have not been able to get through item 3, and we have a long list of speakers still to come, and of course, a response from our regional director. So as we are set for a well-deserved healthy break, we are going to invite you to come back at 4:10. That's in about 15 minutes. But before you leave us, I'd like to invite you for a short relaxation session with breathologist Stig Severinsen, who is a world-famous freediver, who will introduce us into some simple breathing techniques for relaxing and re-energizing. Stig, a warm welcome. Over to you.
Thank you very much, sir. I hope that I'm on camera, will be invited on camera. So I just need a little confirmation that I will be on so everyone can see me. And I think it's coming.
You're there. Great, we have you.
Welcome everyone. Thank you for this wonderful opportunity to share some breathing and some insights into the wonderful things we can do with simple things as breathing. Let's get right into it, dive into the first exercise. It's just natural breathing. So all of you sitting there, wherever you are, start breathing with your nose. The nose is for breathing, the mouth is for eating. Why is this important? Because the nose is a natural filter. It gives the air the right temperature, the right speed, the right moisture. But when you breathe with your nose, you also have large amounts of nitrogen oxide, NO, entering the lungs. Nitrogen oxide is antibacterial, antifungal, and antiviral, something we can all use to improve our daily health. So breathe with me into your belly. And just breathe out through the mouth. That's fine. Again, feel the breathing, feel the air coming into your nose. Very importantly, there are 4 phases in breathing. 4 phases. You breathe in with me all together. Then you have a slight pause. Then naturally just relax. And exhale, and then again have a slight pause. Time for the breath to turn. So 4 phases. Stress breathing has 2 phases. We all know that, right? And if you do it completely wrong, as many people do, especially those who are mouth breathers, you breathe with your mouth. You go into your higher chest, you stress your body, you produce adrenaline and cortisol, and it's not good for your everyday work, and not at all if you're sick or ill by any means. So breathe with me, put a smile on your lips. Through the nose, as simple as it is wonderful. You will feel the lung expand and the energy and the oxygen coming into your system at an optimal rate and level, okay? One last time with me. This will lower your heart rate in a single breath. It will lower your blood pressure and bring you into a calm and relaxed state where you are more in control of your mind as well. Let's go to the second exercise. You've been on for many hours. You're in all parts of the world, which is wonderful, this global gathering, but we can't have you all fall asleep. You need to be sharp. You need to help all your fellow global citizens. So let's do a breathing where you wake up a little bit. I know how it is to be long days at the office. So let's energize the body a little bit. How do we do that? Again, with breathing. We shift the rhythm, we change the dynamics of breath, and it will change your state of mind and your physical state as well. So breathe in with the nose again, and a shorter pause, and then exhale with a little puff, like good work there. I see a lot of you really engaging. I thank you for that. Now, this is a slight hyperventilation, but the body can absolutely tolerate this. This is a great workout for your cardiovascular system, your cardiopulmonary system. So your heart, your lungs, and all the blood vessels in your brain and your body are getting a little bit more blood now. You're raising the blood pressure, you're raising the heart rate, but you're not moving from your chair, yet you're exercising physically. A very good thing also, if you're in a hospital, imagine all the people we could help by actively using the breathing, even from a supine or from a neutral position. Let's do it a little bit more. 3 times like this, you'll be waking up like a cup of coffee. And last time. Okay, you're firing up the sympathetic part of your nervous system. We have a choice with our breathing to go into the relaxed state or the more active state. Now we went into the active state. Now for the last exercise, I want you all to come back to a composed, relaxed, and intelligent place where you're not fearing anything, you're not feeling your body in a rush. This is 1-2 breathing. I call it relax on demand. I teach this to Navy SEALs and to Royal Air Force pilots and to Olympian athletes, but also to people in rehabilitation. That is the best exercise to relax quickly, thus the name relax on demand. It's called 1-2 breathing. So the inhale is through the nose. 1, come with me everyone, breathe in, smile on your lips, slight pause, and then exhale, double the time. I really see a lot of you engaging. I'm really, really honored to have you at this time of day engaging. Again, come with me, breathe in, slight pause, and then use your lips or mouth to make a purge. When you're using your mouth or tongue to make a valve, you get airflow control. It means you decide how long the exhale is going to be. So in this case, inhale is about 4 seconds. Come together with me. Slight pause and breathe out 8 seconds. A little bit more. You're activating the parasympathetic part of your nervous system. It is the rest and digest. It leaves time for recovery, for mental composure, and for smart decisions, which I know you all will have to take over these long days. So these were 3 little simple exercises that can be expanded much more. But it gives you a tool where you come in direct contact with your body and your mind. And with breathing rhythms, you can change how you feel and more importantly, how everyone is feeling. I can see we have 30 seconds. So let's do a united breathing with the 1-2 breathing. So we all breathe together, because whether you believe it or not, actually, when you're breathing and people are observing you, it has an effect on them. They're mirroring your breathing. If you see people that are stressed, you will start breathing here. If you see relaxed breathing, if you look at a kitten or a baby, you will start to relax and breathe in a more efficient way. So let's do it together. You have not seen each other for 1, maybe 2 years. At least let's share the breathing and feel the rippling effect around the world in the 1-2 breathing. Everyone, just 3 breaths together. Breathe in. Slight pause and exhale and smile. Let your shoulders go. I even invite you to close your eyes. Second breath, breathe in slowly with your full might and life. Slight pause and a smile. Let go of any wrinkles. Everything that needs to go, let it out. Slight pause and a last time. Everyone breathing the same air, the same oxygen from the ocean. Everyone is breathing in and letting go, breathing out. Everything you don't need out from your life, breathe it out. And feel ready to go with the next session. Thank you for joining. Thank you for the incredible honor of having me on. And I hope to meet you again. And I wish you happy breathing.
We're just returning to our seats here, and we will start in a couple of minutes. Thank you.
So we want to
Welcome for our last agenda item for today. Item 4, Report of the Pan-European Commission on Health and Sustainable Development, presentation of recommendations and conclusions. The relevant documents can be seen on the slide. Here you see the slide. This is a dedicated session for the presentation of the final deliverables of the Pan-European Commission on Health and Sustainable Development to Member States. As you know, the final report of the Commission was only published last Friday. I suppose that many of our delegates will not have had time yet to digest the entire report and its recommendations. Therefore, the introductions and explanations that we will receive from the Commission's chair and some of the commissioners will be very useful. In that sense, I imagine that our discussion may rather focus on how to take this report and its recommendations forward and how to operationalize some of them. I would now like to welcome Professor Mario Monti, the chair of the Pan-European Commission, and hand him the floor for introducing us into the report. Professor Monti, you have the floor.
Thank you very much, Madam Chair. Director General Dr. Tedros, Regional Director Dr. Kluge, President of RC71 Manastir Liu, Honorable Ministers, distinguished guests, my dear fellow commissioners, ladies and gentlemen. I have the honor today of presenting to you the findings and the recommendations, as it has been announced, of the Pan-European Commission on Health and Sustainable Development. Actually, our report is entitled Drawing Light from the Pandemic, a New Strategy for Health and Sustainable Development. And I'm also delighted to add that there is a strong and extensive supporting evidence for our findings and for our recommendations. This is a review of the evidence edited by Professor Martin McKee, who will be taking the floor shortly. As As this decade dawned, ladies and gentlemen, the world faced an unsolicited and monumental stress test, the COVID-19 pandemic. And as events have unfolded in the months since, we can be in no doubt that our political, economic, and social systems have failed catastrophically to manage the defining crisis of our time. There has been a tragic loss of life and a disastrous impact on livelihoods. We cannot accept the consequences of our failings during this pandemic without trying to identify and tackle their causes. From this darkness, we must indeed attempt to draw light. This is the reason that the Pan-European Commission on Health and Sustainable Development was convened and why we present our recommendations to you today. Leading experts from the fields of politics, life science, economy, health and social care, business and finance have reached consensus on the need for two novel approaches to move forward. Firstly, we must fully recognize the interconnections between the health of humans, animals, plants, and the planet, environment, biodiversity, and climate above all. And secondly, the resulting One Health policy that we propose must in turn be intimately integrated in a wider and coherent policy framework comprising economic and financial, technological, social, and international policies. Today, my fellow commissioners and I share the culmination of a year of review and research, discussions and deliberations. And I want to note with really enormous appreciation for all my colleagues that moving from very different positions, professional positions, political positions, even philosophical positions, and after all, the Pan-European region is so wide and so diverse, we have been able to arrive at a report and recommendations adopted unanimously, ladies and gentlemen. And I find this very remarkable, and I owe it to the seriousness, the commitment, and the flexibility of all my colleagues that we arrived at this unanimous result without meeting even once personally, always online. We believe that the 7 objectives and related recommendations we have set down in our report provide clarity, we hope so, a light by which we can reset the path to equitable, sustainable development. We propose that countries establish One Health strategies so that the linkages and risks related to the interface of human, animal, and environmental health can be addressed in a coordinated way. We call on countries to tackle deep-rooted inequalities, identify those who live in difficult circumstances, and develop policies to give them more security. We ask for the risks and returns around innovation and development to be shared between the private and public sectors. We seek greater investment in health systems, particularly primary and mental health care, as well as in the health workforce. We underline that health surveillance, early warning systems, and crisis response must be strengthened. We suggest improving global governance for health through the creation of a global health and finance board at the G20, a pandemic treaty for joint decision-making, and a global pandemic vaccine policy. We advocate for the establishment of a pan-European Health Threats Council and a network for disease control to maintain political commitment and take decisive action when threats arise. These are some of the recommendations you will find in the report. It remains for me to thank each and every commissioner for their commitment and collaboration, expertise, and I thank those of them who have been kindly available to intervene at this important occasion today, to recognize the invaluable guidance and support of Professor Martin McKee and Professor Elias Mosialos, who brought scientific rigor to this process and coordinated the scientific review. And I wish also to thank Special Advisor to the Chair, Professor Alexandra Torbica, who is here with me today at Bocconi. Above all, I want to acknowledge that this Commission and its report would not have been possible without the inspiration and enterprise of WHO Regional Director for Europe, Dr. Hans Kluge. Dear Hans, I heard you speak words this morning about the Commission and myself, which no doubt concerning myself were largely exaggerated. I will reciprocate your sense of gratitude and of appreciation by saying that you really had a great vision to ask us to do something rather original, that is linking all these disciplines and come to operational proposals with a vision that takes health at its center, that goes very well beyond health. And I believe that our intense activity this year, much more intensive than all of us believe, I must say, may have rewarded you, WHO, the member states, and the world of health generally for your inspiration. The world walked into the COVID-19 crisis lacking foresight, unwilling and unable to reach consensus on current pressing challenges. Countries were stuck, looking on their doorsteps, seeking to solve transnational problems with outdated national solutions. Future generations will not thank us for our short-sightedness. We need a new vision. We present to you a bold new strategy for health and sustainable development in the light of pandemics. Thank you very much, and it is now my pleasure to give the floor to Professor Martin McKee.
Thank you very much indeed, Professor Monti. Dear Professor Monti, Regional Director, distinguished delegates, thank you so much, Mario, for asking me to facilitate this session in which the commissioners will be providing their insights into the recommendations made in the report. And Mario, particularly thanks for entrusting me with the responsibility of chairing the Scientific Advisory Board and leading the production of the evidence review that underpinned our recommendations. This was a challenging task because it soon became clear that the work of the Commission would be extremely wide-ranging, drawing not just on evidence from medical science and public health, but also from political, social, and behavioral sciences. In the time available, I can only say a few words about the evidence review. The review begins with an attempt to ascertain what went wrong and to reflect on how the world will change after the pandemic. Figure 1 in the main report sets out a new conceptual framework for thinking about health. And I hope that you will then look at the evidence review for the material that we have pulled together that underpins this model, because we see it as offering a concept of health determinants that is appropriate for the 21st century. The second part of the review provides the evidence that underpinned our particular recommendations, looking at the arguments for and against the different options and reviewing experiences from elsewhere, geographically, other sectors, and so on, that could provide important insights. So at this stage, I want to invite a number of our commissioners who have played particularly important roles in the work of the Commission, particularly by leading working groups, to provide their insights into some of these recommendations. And the first that I would like to invite is Professor Louise Fresco, who is the president of the executive board of Wageningen University in the Netherlands, who led our work on One Health. Louise, please. And I know that Louise...
Yes, I wasn't allowed to mute myself. Thank you, Martin. Excellencies, distinguished delegates, members of the WHO community in general, it's a great pleasure to present a few of our main insights around the concept of One Health. As you heard Professor Monti say, one of our two pillars, in a way, is this concept of One Health. Now, One Health is not entirely new to you. It's been around for about 20 years. But what we've done is to really articulate the intersection between human health, veterinary animal health, and ecosystems health. And the diagnosis of this zoonotic pandemic is really that because these three were not aligned, because our insight was insufficient, and because we didn't have the tools to cut across these three different areas, we were unable to guide any quick response. When it comes to prevention, the most important thing is that from a local level all the way up to a global level, we understand the articulation between how human health is influenced by veterinary health, and that in turn often by ecosystems health. It's not always only one directional, because humans have a great impact also on animal health and of course on the health of the ecosystem. Just to give you one example, the fact that we have put so many natural habitats under pressure because of land clearings for agriculture has meant that there is far more interaction between wild species carrying pathogens, disease agents, that then could be moved towards the realm of humans, either directly or indirectly through host species. So in order to move forward, One Health is both a concept, an approach if you want, but it's also an outcome. We believe strongly that if there is no One Health, we cannot move forward collectively. And this is an issue that raises its head at many, many different levels. What can governments do? The first important thing is to move towards an integrated One Health strategy, which on the horizontal level links different governments, different government agencies, I should say, in the veterinary realm, in the human health realm, and when it comes to ecosystems, the nature and environment ministries, to develop a common understanding, to develop a common strategy, to develop common capacity building so that the knowledge to deal with this crisis is everywhere. That is a major job. It will not be done by tomorrow, but we feel that this understanding of One Health, of how it works out right from the local level to the global level is important. At local level, it will mean, for example, that cities need to deal with their rat population or with their wild animals in and around the city. It will also mean that we have to deal with nutrition, because we have seen that nutritional status is a major risk factor for the human population. So in all, we would like to advise a really strong approach at national level to integrate these different realms of health and to move forward to implementation. Thank you very much.
Thank you very much. I should say that for some reason or other, we're not being allowed to unmute ourselves here. Can I now invite our second commissioner, President Tarja Halonen, former president of Finland and currently the chair of the board of Helsinki University, who has been asking how we can heal the fractures that divided our societies during the pandemic. Tarja.
So thank you, ladies and gentlemen. I, of course, fully agree what has been already mentioned by our colleagues. But everybody, I think, is the same. The COVID-19 has taken a long time, and it will continue. The resilience of the individuals and also the whole society has been tested quite much. So in my remark, I will concentrate on the part of the report that digs into the underlying societal problems and demonstrate how existing inequalities have worsened the effects of this pandemic and threatened the resilience of us. So while everyone has experienced some effects, of course, of this pandemic, some other people were harder hit than others. Crises such as this pandemic are like a magnifying glass that show and amplify the existing problems in the society. Trust in the society has a key role also concerning the pandemic. Social inequalities and structural discrimination have made space for growing polarization of the society and led to mistrust of political institutions and science. This, on the other hand, can hinder and has already hindered effective response measures. We call for the decision-making which involves both the whole of government and all of society perspective. We call for putting inclusiveness, social cohesion, as well as science and evidence at the heart of all policies. So all stakeholders at all levels have a role to minimize inequality and mend the fractures which left so many vulnerable to the pandemic. So in this context, prevention is also the idea behind sustainable development. Prevention saves lives, systems, and resources. The pandemic and its response measures have affected also sometimes very differently the different people. And one clear sign is that women and men have been treated differently. Men have suffered disproportionately the direct, harder hit by the secondary effects, those that can be harder to identify. For example, women have been much more likely to lose their jobs during the pandemic. Violence against women has increased during lockdown. Studies show that unpaid care workers' responsibilities have increased greatly for the women compared to the men, and this list goes on. So in all societies, women in the families have had a lot of responsibilities. We call for the attention to these existing structural inequalities by collecting relevant data and identifying those people who are in disadvantaged situations. And finally, we all call for special emphasis on gender equality beyond nice words and towards concrete actions. So if we do it now, so it will help also in the next pandemic and also in other crises. Thank you very much.
Okay, thank you. Thank you very much. So at this point, I'm going to say a few words about objectives 3 and 4. Objective 3 considers innovation as a means to improve One Health. The pandemic, as we've already heard, has reminded us of the power of scientific innovation to promote and protect health. The development of vaccines, some using completely new technologies in record time, has been a truly remarkable achievement. And so too has been the ability to launch large-scale clinical trials, such as Recovery and Solidarity, to evaluate new and existing medicines, identifying both those that work and, as importantly, those that are advocated by some, but which do not work. Yet, we've long known that the way that we organize medical innovation is far from perfect. We still have far too much effort being put into the development of products that offer little benefit, while those that are needed, in particular new antimicrobials to combat the challenge of resistance, attract little investment. There's also a problem that in many areas, governments have taken on the risk funding the basic science while the pharmaceutical industry has reaped the benefits. And another problem is that even when we do have major innovations, we often struggle to implement them widely to ensure that everyone benefits. So we see that there is a need to look more systematically at those areas where further advances are needed, based on the simple criteria of whether they offer the potential to improve One Health. And we call for a true partnership between the public and private sectors, recognizing that both have a critical role to play, but that the risks and returns should be shared between them. And finally, we look to the regional office to continue its many efforts to support countries in their efforts to ensure that their health systems are able to take up these innovations for the benefit of all for whom they're responsible. Objective 4 calls for investment in strong, resilient, and inclusive national health systems. It won't be a surprise to read that we call for an increase in investments in health systems, especially in those areas that have traditionally attracted fewer resources, such as primary and mental health care. But this must not be a blank check. The money has to be spent effectively and in a way that recognizes the many changes that have taken place in recent years, including those that have been accelerated by the response to the pandemic, such as the increase in remote consultations. We pay particular attention to an issue that has already been discussed by several of the member states, the health workforce. Many countries in Europe have failed to train enough health workers, and even if they have, they've often struggled to retain them. It's particularly problematic in the aftermath of the pandemic, when large numbers of health workers have experienced burnout or moral injury. So we need to be able to attract and retain more health workers. We will have to give them improved working conditions and opportunity for career promotion. But we also expect something from them, given the many changes in our society, and in particular the scope for shifting tasks between different types of health workers, between health workers and patients and their carers, and between all of these groups and machines. We need to find new ways of working that are not limited by outdated restrictive practices. And finally, we need to relearn the lessons of the past, in which some countries have never forgotten, that health and social care are a continuum. If we underinvest in either, the other will suffer. And in many countries, the relative neglect of social care led to huge numbers of avoidable premature deaths, and we cannot allow this to happen again. So now let me introduce Sylvie Goulard, the Deputy Director of the Banque de France, and a leader in the initiative to green the financial sector, who will tell us about Objective 5. Sylvie.
Thank you, Martin. Thank you, all of you, to be present for this presentation. Well, maybe in front of you from the health sector, it's not difficult to plead for more investment in health. But the reason why we put this objective